I just finished choosing my ACA insurance for 2026. This would normally be a Friday video, but I wanted to get this out as soon as possible because so many people have been worried about ACA prices for 2026, including me. I got an email from ACA at the end of October that said if I kept the same insurance plan, it would be $63 a month. But I think this was assuming my income would be the same as last year. Open enrollment started on November 1st. The temporary COVID inflation subsidy enhancements expire at the end of this year. Health insurance costs were predicted to go up by 18 to 20% in 2026. So many of us have been really concerned about this. In 2025, I've been getting a $782 a month tax credit and a $1 a month in Cascade Care savings. So this year, 2025, I'm not paying any premiums. I made a video a while back about how to estimate your 2026 ACA premiums. I found a calculator where you could calculate the difference for yourself for this year with and without the expiring enhancements. The calculator gave me a number, and then I added in 15% for inflation. I came up with $166 a month as a prediction for me for 2026. Let's see how close I was. I want to remind you I'm not an ACA expert. You can talk to a broker to help you. They even have a link on the website. But I was told by a viewer if you put in your phone number, you'll get tons of phone calls. They suggest using a broker that someone refers you to. I'm going to share how I signed up, what plans I was offered, and what I chose. You definitely need to do your own research. I logged into the Washington Health Plan Finder website because I live in Washington State. I'm going to update my reported household income for 2026, but this part is tricky. I have to guesstimate how much income I'll have in 2026, and I don't want to change my income now or it could affect my November and December premiums. So I went on the website without logging in to see the cost for plans at different income levels. You can get estimates based on your information, but they could be slightly different than the actual costs. My 2025 reported income on ACA is $26,000, but I want to raise that to $30,000 so I can pull more from my retirement accounts. So my projected income will be $30,000 a year net income. I will log in January 1st and change my income on ACA. My plan is if YouTube income ends up being more than I'm projecting, I can open a SEP IRA. You can open a SEP IRA and deposit your YouTube income into it so ACA doesn't count it. If YouTube is less than I projected, I'll pull more from my retirement accounts and put that back into my Roth and my high yield savings account. If I need any income beyond that $30,000 a year, I'll pull it from my high yield savings account. In order to keep my ACA costs low, I have to do some financial planning, shuffling, and readjusting. So I shopped for plans. So for medical in 2026, I'm eligible for a $1,089 federal tax credit to lower the cost of insurance and $55 in Cascade Care savings if I go with one of those plans. That bumped up a ton from last year. Last year it was $782 a month tax credit and $1 in Cascade Care savings. The premium almost doubled, but so did the tax credits. This is based on the projected $26,000 net income I have in 2025. I will change that in January. That's reportable income. I've talked about being poor on paper before. Any after-tax money like Roth, CDs, high yield savings does not count, at least not yet. Only the interest from CDs and high yield savings accounts would count. When you click on Shop for Plans, you can add your doctor, clinics, hospitals, and prescriptions to see if they take the plan that you're looking at. They pop up in order from suggested, but you can also sort by least cost to greatest. There are several that came up free for me this year. I compared 3 plans without logging in using a projected $30,000 income. I had Better Cascade Silver Select for 2025, and I've been happy with it, so I put that as an option. It came up as $158 a month with that $30,000 income. Then the next choice, Better Cascade Select Complete Gold, came up as free. The deductible is a little higher for this one, and copays are a little more, but the estimated yearly cost is less. I'm assuming that's because there would be no monthly premiums. The really weird thing is gold plans are supposed to have higher premiums. For choice 3, I added the bronze plan. It was also free. It has much higher deductibles and out-of-pocket maximums. But new for 2026, you can use a health savings account with an ACA bronze plan. I'm not positive if I would be able to do this with my HRA, but I want to save that HRA money for the future anyway. I had 37 health plans to choose from. There are so many things to look at and consider. There's your premiums, your primary care visit costs, generic drug costs, out-of-pocket max, if a primary care provider is required, the annual deductible, the plan type, whether it's an EPO or an HMO. Those were the only 2 types that came up for me. You can also click on more information for each plan. My 3 choices were all HMOs. I will need a primary care provider, and they all accept the doctor I used this year, who I really like. This year, my mammograms, colonoscopies, and well checks were covered. The only time something wasn't covered is when I went to an out-of-network walk-in clinic for a sinus infection. That was my fault because I didn't look it up ahead of time. I get an occasional sinus infection or something like that, but I hardly ever go to the doctor. But if I need surgery or something big, I'll be covered. I've spent a lot of time researching my options. At this time, I'm healthy and I don't take any medications. But I don't want to go without insurance. Washington State is number 3 in the top 5 most affordable states for health care. That, combined with my low taxable net income, makes it so I can get free or inexpensive health care again in 2026. I'll see what's going on at the end of 2026 and reevaluate then. Ultimately, I decided to go with Better Cascade Complete Gold, the free one again for now, while I'm still healthy. But just out of curiosity, I put in different income amounts without logging in again to see at what point this plan would cost money. If I had $34,000 of income, it would be $9 a month. You can play around with the numbers this way. In January, I'll change my income on ACA to $30,000 so I can still pull some money from pre-tax retirement accounts and put it in after-tax accounts. My ACA reported income for 2025 was $26,000, but I had my after-tax bridge money for over half of 2025. With this free insurance, I'm covered in case of a catastrophe like breaking a bone, appendicitis, cancer, or anything like that. My $166 a month prediction was for the Better Cascade Select Silver plan I had in 2025. In 2026, it would be $158 a month at an income level of $30,000. So I think I was pretty close with my prediction. I played around with the Better Cascade Select Silver plan I had in 2025 some more and put in an income of $26,000, which came back with $63 a month. An income of $28,000 came back with $133 a month. And an income of $30,000 came back with $158 a month. But ultimately, I decided I wanted to update my modified adjusted gross income to $30,000 in January and go with the Better Gold plan. I actually tried to change my plan now, but I got the message that if I change mid-year, my costs may be reset even though it also said I was shopping for 2026 plans. So I will go in and officially change it in the beginning of December. There is a deadline this year of December 15th for coverage starting January 1st, 2026. I hope this gives you an idea of how the process goes and eases your concerns. I'm relieved that my costs didn't go up 50 or 75% like the media kept reporting it would. I mean, the premiums did go up a lot, but so did the tax credits. It's a little different for each state and at different income levels. The cost may vary significantly if you have a higher income and if you live in another state. But for us modest income folks, it's not bad at all. I'm pretty happy with it. If any of you are seeing me for the first time, hi, I'm Julie and this channel's Happy on Monday. Thanks for joining me. If you found this helpful, please like. And if you're interested in retiring early, consider subscribing. I'm going to leave you with a quote. Dream as if you will live forever, live as if you will die today. Hope to see you again soon.